Hello, my name is Eamonn Sullivan and I am an NHS Chief Nurse in the Royal Berkshire Hospitals. I'm also an Army Reserve Officer in Queen Alexandra's Royal Army Nursing Corps. So I've been an Army Reserve nurse since 2001 and the role of the nurse in the Army is quite different to that in the NHS. The core role is the same, so caring for patients whether you're in a hospital or in a military situation is the same, but quite often the responsibilities are quite different. Generally in the NHS you are a super specialist nurse, so if you work in the emergency department you're an expert in emergency nursing. If you work in the surgical wards you're an expert in surgical nursing. Army nurses have to be really adaptable, so we really have to work right across the whole hospital, the whole environment of healthcare. Yes, we have our specialist qualifications, so I'm an intensive care nurse, but I will also be expected to work on the wards, to work out in the field, to work in the emergency department, to work right across the land space that we operate in. And that's one of the key differences, that agility and that ability to work in different spaces right across the area of operations that we're working in. As an Army nurse, we're non-combatant, which means that we cannot take up offensive arms or be in offensive action against the enemy. However, we are allowed under the laws of armed conflict to bear weapons, to carry a rifle or a pistol to protect our patients or ourselves in the event of us being in a hostile situation. When you operate with the military, whether that be in war fighting or peacekeeping or any remote part of the world, as an Army nurse you're very cognizant of the value of every single piece of equipment that you have, whether that be a bandage or a medicine or an intravenous cannula, because we're aware that people have risked their lives to get that to you in the field. The equipment has had to travel possibly right across the world by air, by sea or by land, so myself as a nurse can actually use it. So we're really conscious of how precious the equipment that we have is. Throughout history we've seen that the tragedy of war has led to many medical advancements. From Florence Nightingale's time in Crimea right the way through to more recent conflicts such as those in Ukraine. So if I can give you some examples. Battle of Britain pilots quite often suffered terrible burns, and the care of those pilots in the Second World War and the advancements in care is still used today to care for victims who are injured by fire. The use of antibiotics, the use of blood transfusion, all of these elements were pioneered in the Second World War. If we look at more recent conflicts, the use of blood and blood products right up to the point of wounding has saved many lives, and also the use of anticoagulants to stop mass hemorrhage has been really life-saving. And indeed, if we take the lessons of Iraq and Afghanistan, where the British Army in particular and the armed forces pioneered the whole structure around how we care for trauma victims, that's been exported to the NHS today. And that structure, how teams work, how they operate, how quickly they triage patients to get them to the CT scanner or to the operating room, has saved many thousands of lives here in the NHS. I've been an NHS nurse for 33 years and I've been a nursing officer in the British Army Reserve for 22 years. I've served all over the world. I've served on operations in Iraq and Afghanistan as the nursing officer in charge for intensive care, and I've served on exercise in many places: Germany, Norway, France and the US. And I guess my military experience and my NHS experience really prepared me, although I didn't know it, for my leadership positions that I was responsible for in the pandemic. So in the wave one of the pandemic, my NHS role was Chief Nurse in Royal Marsden Hospital, and I was in my military Army Reserve role also. I was asked to attend a meeting one morning early in March, and we were told, a group of us who'd never met, were told that London was short of 4,000 intensive care beds and that we were the small team that were going to have to deliver that and deliver it in 10 days. We set to work straight away. We broke into small groups: military, NHS, architects, management consultants, logisticians, and we began to work out how are we going to deliver this enormous task in very short order. At the end of that first day, we regrouped and we decided we had to call this quite enormous endeavour. It had to have a name. The environment that we were going to care for Londoners in had to have a name. Colleagues said we would call it Excel Hospital Number 1 or COVID Hospital Number 1. And then a colleague of mine who was an intensive care nurse and also the chief executive of a large hospital said, no, we're going to call this Nightingale because this is Year of the Nurse. This was 2020. And Nightingale gave people hope during the terrible years of the Crimean War. And we wanted to use Nightingale's name to give Londoners hope. We all agreed. And there and then, that's where the name, the Nightingale Hospital, began. So the name Nightingale stuck in London, and after that, that became the name of the other temporary hospitals across England. The difference was that the London Nightingale was the only temporary hospital to actually take intensive care patients and to become operational. We cared for 60 Londoners with COVID. There were ventilated intensive care patients. And to put that in context, we were at the height of the conflict in Afghanistan, we were maybe caring for 5 to 7 ventilated soldiers. At the peak of Wave 1 in the Excel in London, London Nightingale was caring for nearly 40 ventilated Londoners. So this was a huge endeavour that was executed with the fantastic collaboration between the military and the NHS and also industry as well. And we couldn't have done it without each other. So the NHS brought unique skills, the military brought unique skills, and industry also brought unique skills that were completely interdependent and came together to provide Londoners with great care. We realised that this was going to be really high risk. We realised that we needed a vision statement for our staff, that we needed to make this really easy for people to understand what we were doing, because it would be quite frightening for staff who are coming from all over London to be exposed to ventilating people and caring for patients in a big conference centre. So we came up with a couple of statements. The first was that we were there to save Londoners' lives. The second was that we would ensure wherever we could to ensure that nobody would die alone. We also said that we would treat the staff like rock stars, and what we meant by that was that if one of our nurses' nan in Newcastle needed a pint of milk and that was worrying her or him, we would make sure that her nan got that pint of milk. And finally, we realised that this was really high risk, and we had to, in the kind of terms of Nightingale, we had to keep improving. We had to be improving every day, every week, or else we'd be going backwards, to use a Nightingale quote. So we put in a really advanced learning system to do just that, to make every day better than the last. Nightingale London was constantly calling on the expertise and the knowledge and the wisdom of our military colleagues, our military nurses and doctors, and likewise also our NHS experts as well. But one example of where we used military know-how to support staff, because staff welfare was really, really important to us, and we placed staff welfare on the same priority as patient outcomes. So we were there to support and care for Londoners, and we were also there to ensure that the caregivers were also freed up of the daily distractions and the stresses so they could do what only they could do, which was provide great care for those patients. So we used British Army knowledge of how they care for their soldiers on operations, and we used that knowledge how we cared for our staff in the Nightingale. So we ensured that they had accommodation on site, that they had food, that they had internet access, that they had adequate periods of rest, and we used all those years of expertise on operations to support the NHS staff in caring for Londoners at Nightingale London. We lived on site in the Excel for nearly 3 months, and at the end of May in 2020 we went back to our families for some rest. That was just after the end of Wave 1. I then went back to my NHS job as chief nurse in the Royal Marsden, and the hospital there had done a tremendous job in looking after cancer patients in London. The Royal Marsden is Europe's largest cancer hospital, and it again had been really innovative and agile, as many NHS organisations had been in caring for patients during the pandemic. So at the end of the summer in 2020, I was asked if I would be the chief nurse for testing in England at NHS Test and Trace, working with some brilliant doctors, nurses, scientists and colleagues from industry, and also logisticians as well, because a large part of the testing effort in England was about supply and getting laboratory supplies and equipment right up to the point of care and right where they were needed most. So we had such an eclectic team of people from army, from supermarkets, from NHS right the way through, working around the clock to increase the testing capability in preparation for the next wave of COVID, which was due to hit us in winter of 2020-2021. I had many jobs in test and trace, but the one I'm probably most proud of is working with the small team who deployed lateral flow tests into the NHS and social care in that winter of 2020-2021. That was really important because the plan behind that was to detect staff who were asymptomatic so we could actually reduce the cross-infection and nosocomial infection in hospitals. And there's lots of evidence to suggest that that actually has had a big impact in reducing the burden of COVID during that very, very difficult winter. So in wave one, I was working obviously in NHS Nightingale, and in wave two, as well as working in test and trace, I worked in intensive care in London Teaching Hospital. So my military background really was an enormous help to me in being able to care for patients and also care for staff during the pandemic in wave one and wave two in particular. The Army teaches you how to problem solve in a different way. It teaches you how to look after your colleagues and your staff in a different way, and really work in very austere environments with confidence and with compassion. And that's something that I drew upon many, many times when I was working in the Nightingale London, or in wave two when I worked in intensive care in a London teaching hospital. I think leading and caring for Londoners in wave one of the pandemic in particular I found a very violent experience, much more violent than even serving in Iraq or Afghanistan. And the reason for that was that these patients, many of whom survived, were struck down by an illness out of nowhere. And they were kind of London's best, if you like. They were nurses and porters and bus drivers and security guards. And many of them were people of colour. And indeed, in the Nightingale, at any one time, we could have 30 people of colour and maybe two white people. And that was really striking. That was really quite upsetting for a lot of staff. And the staff, indeed, who were doing so much to care for them were just ordinary nurses and doctors like myself, and therapists and pharmacists and everybody else. And again, they were just trying to do their best, and they were thrown into this really difficult situation, and they did an absolutely tremendous job. In particular, I think for me, in wave two, the contribution of internationally educated nurses in particular was really inspiring, and I feel we owe them a great deal of gratitude. I can remember working in intensive care in a London teaching hospital, where you would have one ICU nurse, quite often an internationally educated nurse, and they would be supported by people like myself, or a haematology doctor, or a pharmacist, or a medical student, and they would be coordinating the care of 4 or 5 desperately sick people, and they were just doing it magnificently under just immense pressure. So I feel we owe them a great deal of gratitude. Our internationally educated nurses were just absolutely fantastic during COVID. Florence Nightingale and Mary Seacole are my health heroes. They are still today the most amazing role models, and many, many nurses will call upon their teachings and their wisdom almost every day in their clinical practice. I'm really very proud of being an Army nurse, and I've absolutely loved every minute of my career so far. I've travelled all around the world. I've pushed myself professionally into spaces that I never thought I'd be able to perform in. I've made some wonderful friends, and I've seen some wonderful places. I've learned so much in my military career that has helped me in my NHS career, whether that be through leadership, through clinical practice. It's been an enormous benefit to me as a person and as a professional, and all of that came together, if you like, in COVID, where I had to draw upon all the different skills over many, many years in my roles during the pandemic.